afternoon. It's 6 minutes past 1, and this is Manx Radio live from the Isle of Man. The Mannin Line in session through to 1 today, and the Health and Social Care Minister David Ashford MHK is with us live. If you want to get in touch, you can text on 166 177, email studio@manxradio.com, or you can call 66 13 68. Well, who would have thought, in the forbidding days we've had in the past 3 months, we'd be where we are today. And I'm delighted to say David Ashford MHK is live in the studio. It's the first time we've been at the end of phones for something like 3 months. Are we really clear now?
Well, you know me, Andy, I'm very, very cautious. I think at the moment what we can say is there's low to zero community transmission, so we're in a very, very good place. But that doesn't mean we should be complacent. This is a virus. It can always come back.
We've had no new cases now for how long?
It's 32 or 33 days. I'm beginning to lose track myself now.
What are the probabilities of there being a case? And if there were a case, how would it have happened?
I think the only probability now for a case to emerge is someone coming into the island via the borders. But obviously there's isolation criteria, so we would expect them to be isolating. But obviously if they were identified while they were isolating, that would still be a case on the Isle of Man. But there shouldn't be any community cases currently.
David dropped us a note. He said, a question for Mr. Ashford. I'm a Manx resident in Spain wanting to return to the Isle of Man. What are the UK regulations for me when I enter a UK border? Will I be able to travel through the border without self-isolating in the UK while I wait for my travel documents from the Isle of Man government?
But my understanding is if someone's coming abroad into the UK, if they're a Manx citizen, then they do have to self-isolate within the UK for the period that they're there. There's nothing to prevent them travelling through the UK to get to the port to be able to come back. But if they're staying within the UK for a number of days, they do need to self-isolate during that time.
OK. Stephen, a question. In the UK, there are certain exemptions in place for people not needing to self-isolate for 14 days. One of them is being a seafarer. My question is, would a seafarer that's returning to the Isle of Man from being at sea be exempt like the UK rules, or are they required to self-isolate on the Isle of Man?
Currently, they are required to self-isolate as well. The reason being that the 14 days is one of the big protections that we've had because it's the top-end incubation period of the virus. And for many cases, it's also the life cycle of the virus as well. So it is a big protection for us. So unlike the UK, we are not willing to waive the 14 days.
OK. A question that said, after 3 months of being locked down, is the Minister concerned about the mixture of other viruses that will be around? We're talking about children going back to school now, and the mixture of measles, mumps, rubella, chickenpox and things like that. The normal kind of run-of-the-mill viruses that we've had. Do you expect those to reappear?
I mean, obviously, there's always a concern about that. Viruses do circulate in the community constantly throughout the year. We haven't seen any evidence of any increase in other forms of viruses as yet, but you would expect other viruses to circulate as normal.
OK. Can you give us any update on the situation regarding Abbotswood?
So all I can say in relation to Abbotswood is the DHSC, we have had to suspend our inquiries because Expol, who we brought in, said that their investigation said it was a matter that reached the threshold to be referred to the police. It has now been referred to the police, and therefore its police investigation's ongoing, so I can't comment on an ongoing police investigation.
And everybody who was reallocated, they're still elsewhere, are they?
So most people now have actually been moved out of DHSC facilities and have been relocated to other homes. The figure I have in front of me at the moment says there's 7 people still from Abbotswood in DHSC facilities, but I believe that every single one of them has now been allocated a place at another care home.
The situation as it is now, just about everybody is back where they should be. What's the situation with dentists and opticians?
So in relation to opticians, we're working with them to get their standard operating procedure in place so that they can reopen as soon as possible. There's been lots of discussions going on with the opticians between my chief executive and DHSC and their representatives, and I'm hopeful that we should be able to have announcements around that either the end of this week or the start of next. In relation to dentists, they are open reopen, but only for certain procedures. They're not doing the routine at the moment. Their standard operating procedure and procedures are due, I believe, to be reviewed at the end of this week. And again, there'll be able to be further announcements end of this week, start of next.
So when do you think dentists and opticians could reopen?
So, well, dentists are reopen, I should point out, but only for certain procedures. In terms of a restoration to normal, it will have to be a phased approach.
Okay, a question in from Mike, and it said, how long will it take to take up the slack of missed appointments and deferred courses of treatment and screening programs?
It will depend upon what someone is waiting for, because obviously the waiting lists are different depending on what procedure. But I've been perfectly honest and blunt about this the whole way along. COVID is going to have quite a big impact on our waiting lists, and in some areas we may potentially have to look at what we can do waiting list initiative-wise to bring them down. But the big problem we face is other countries are in the same position. So there's not going to be UK consultants we can just call on to bring our lists down, because the UK is in a similar position and they'll be dealing with their own lists.
So this could take months.
It could be a long time. It could even take over a year to bring the lists back in line.
Before coronavirus hit, the Health and Social Care Department was afflicted by shortages in various places, shortages of skill and shortages of personnel. Is that still the case?
It is still the case. It's certainly not changed over the COVID period. We have been continuing with recruitment over the COVID period, and we did manage to make some more appointments. But yes, we still do have shortages of staff. It's the same within the UK and most of Europe as well. There are certain specialities where it's very, very hard to get the staff in place.
A question in now, this is G, who said, what's to prevent a visiting essential worker who can't go to a UK pub going to a pub while they're here and spreading the virus?
Well, the fact is they are issued a direction notice upon entering the island. So key workers aren't allowed to circulate in the community. If they do so, it's a criminal offence and they will be arrested and charged.
Because there are all sorts of Manx whispers about key workers distributing here, there and everywhere. So that is a criminal offence. It
is a criminal offence. They have to, when they come in, they are allowed to their place of work, but they have to travel between their residence, be it a hotel, and their place of work, and they must self-isolate outside of work for 14 days. If a key worker has obviously been in the island longer than 14 days, then they are free to move around.
David Ashford MHK, Minister for Health and Social Care, is with us live on the Mannin Line on Manx Radio. We're also streaming on YouTube as well. And a note in from Chris said, can you ask the Minister what controls are in place to stop using compassionate travel permission to go on foreign holidays?
Well, it wouldn't meet the criteria for compassionate travel for a start. It is a very strict criteria, and I know that the team in the Cabinet Office do background checks to check that the information they're being given is accurate.
So nobody can fib.
People could probably try and game the system, but they stand a very high likelihood of getting caught. Someone would not meet the compassionate travel purposes for just, say, going off Ireland for 2 weeks to Spain.
Just to reiterate this question, Ian, given the optimistic talk on the virus by the government, when will surgery appointments be back to normal?
Elective surgery, we are looking to get up and running within the next week or so to start getting some elective surgery. One of the theatres we converted to give us expanded intensive care capacity, so that's having to be converted back. But again, it's one of those we should be able to give an update on the end of this week. But again, I do have to emphasise, when the person says back to normal, there are going to be extended waiting lists because of the COVID-19 situation.
Okay, let's go to Ken, who's on the line. You're on the line with David Ashford. Ken.
Good afternoon, gentlemen. Although not a big believer in the antibody tests we bought, because I couldn't see the point in them, how many have we actually used? Because the millions sitting in warehouses in the UK.
Right, well, what we're doing, Ken, is we're calling, because they have life expectancy on them, the antibody tests. So we've bought 10,000. We're doing the first 5,000, which we've called off between now and the end of next month. We've currently used 2,000 of those 5,000, was the update I had this morning.
And are there any results out of those two?
There are, but we're not going to publish results intermittently because they're not like swab tests. What we're doing with antibody testing is we're basically doing a population study. So it's to see how widespread the virus went throughout the community. So we'll be doing an interim report, which will be a public report after we've completed the first 5,000, and then we'll be doing a final population study report, again a public report, once we've finished the 10,000.
Okay, thank you for that.
What are you hoping to gain from that report, from the population study?
So basically it's to see how this virus has spread across the community. So we're looking at random samples of people who'd called 111 and have proven negative. We've been looking obviously at the positive cases to see if they were in the end positive cases, whether they've got the antibodies there. And it's to see across different age groups if there was a spread of the virus that we didn't know about.
Is the population, you've often talked about the clinical advice, was this outside clinical advice, or were they members of the Isle of Man civil service and clinical staff that were giving that clinical advice?
So clinical advice is delivered by our clinical leadership team. So the clinical leadership team is chaired by the Director of Public Health. It has GP representatives on, it has the clinical psychologist. I apologise because I'm bound to miss someone here. It's also got obviously our medical director. It's got all of the clinical consultant leads on it as well. And there is also community represented on there as well, and they come up with the clinical advice as a group that then feeds forward to council and ministers.
Could you, because some people have heard about this but don't know how it works, what are the rules for returnees? And who vets the self-catering accommodation and polices self-isolation?
So in terms of rules for returnees, there's various grounds on which they can come in now. There's the compassionate, obviously. It's a resident who hasn't left after the borders closed, who's trying to get back to the Isle of Man. There's obviously people with patient transfer as well who we sent in. The rules have changed in the last couple of weeks where people can self-isolate at home now, even if there's other members of the household, but it means the whole household has to self-isolate. It is up to now being policed by the police themselves, who have actually made visits and calls. The calls will be continuing going forward. Government will be continuing to make calls to those self-isolating to ensure that they comply. And as I say, it's a criminal offence for them not to.
A question in, this is Chris Kay, who said, at what stage will GP surgeries get back to normal and you can physically see your GP?
So we are looking at that for people to go in. But one of the things I want to state as well is we do want to keep some of what we've got now. So the telephone and video triage in many cases has worked very well. So we will be keeping some of that in place. That's part of the Sir Jonathan Michael review on the transformation of healthcare services anyway. But in terms of people turning up to the surgeries where required, that should be in place again in the next few weeks, we're hoping. But we have to speak to the GPs and engage with them on that. And one of the things I would say, and I need to stress, is over the COVID-19 period, if someone does really need to be seen by the GP, they were still being seen. It wasn't a case of the GPs didn't see anyone. If the GP felt the person needed to come in for an actual physical examination, that was still happening.
Interesting that some of the behaviours and some of the things you've had to adapt to during COVID-19 may be adopted in future behaviour.
They will indeed. I mean, I think I stated at one of the press conferences that there are some good things that will come out of COVID-19. Certainly from a health perspective, there are things we want to hold on to. So the 111 helpline is very something we want to keep. We also, the video conferencing we've put in place with consultants in the UK, that's something we'd want to keep. A lot of things that we were due to deliver anyway, as the Sir Jonathan Michael Healthcare Transformation Review, we've been able to do during the COVID-19 period.
Plenty of notes coming in. Text 166 177 or email studio@manxradio.com or call the Minister on 66 13 68. Please thank the Minister. This is Gary in Crosby. Thank the Minister for all his and his team's hard work during the pandemic. Ask if he's going to stand for Chief Minister. Well, I don't think you can stand for Chief Minister, can you?
Well, I haven't even decided if I'm standing for re-election next year, Andy, so let's take one step at a time. But
you don't know whether you're going to stand?
I'm a bit of a strange politician. I always decide about 6 months before an election. I was the same when I was on Douglas Council. I always decide about 6 months before whether I'll stand again.
Hello, Gary. You're live with the Health and Social Care Minister. Alistair, hello.
Oh, hello. Good afternoon, Minister, as well. There's a couple of points I just would like David to try and answer if he can at all, please. The first one is, what are the current rules for leaving the island for a resident? And the second question is this not an opportunity which is long overdue for people, before we open our borders, could we not consider now passport identification for people coming to the island for the future?
Couple of points there. Firstly, in terms of residents leaving the island, there is no criteria. Anyone is free to leave the island. There's no restriction on that. But obviously, if they want to return into the island after having left, they've got to meet one of the criteria around the compassionate travel, as to why they've actually left the island in the first place. So there's no actual criteria in stopping someone leaving the island. They just have to meet the criteria to be able to get back in again. In terms of passport, I know this is something that has been looked at about ID. It can't be pure passport control, because in that case we would actually be in breach of the common travel area, is my understanding. So if we went for full passport control, we would no longer become able to remain a member of the common travel area. So there, obviously at airports you have to produce photo ID, and that could be something that I know in the past has been looked at and discussed and may well be looked at again.
Right, well, thank you very much for that. But if I just may say so, it would appear as though the UK is leaving the European Union in December, or if not before. And if that's the case, will this common travel agreement still apply? I mean, how strict is this common travel agreement?
Yeah, sorry, I should have been clear. The common travel agreement is us, the UK, the Republic of Ireland, Northern Ireland and the Channel Islands. It's nothing to do with the European Union travel area. It's a common travel area between ourselves, and there is strict protocols around what we have for free movement of people within that common travel area. So it is quite strict, the criteria we have to meet.
Okay, thank you very much.
A question in from Mark to David Ashford. Do you have a timeline for when cinemas, theatres and other concert venues will be open for normal operation?
Well, there is nothing to stop them now, Andy. The restriction has been removed, but obviously it's up to the individual venues. One of the things is, because of how well the Manx public have done in tackling this virus, we've been able to move a lot swifter than I think any of us were expecting, certainly swifter than I was expecting as Minister for Health and Social Care. So announcements have been made very, very quickly. So a lot of places and a lot of industries have been caught off guard. So it is taking time for the cinemas, for the concert halls and so on to actually get in place, get the staff in place and bookings in place even to be able to reopen.
In those grim, dark days, people like yourselves, people like the Treasury Minister, were looking over the precipice. What's the key to our success? How have we got where we are now?
I think one of the things that's helped is clear and concise communication with the Manx public, is getting the message out there. There was no soft soaping it. There was no trying to play it down. Myself and the Chief Minister tried to be brutally honest with the Manx public, and it was the way the public reacted that has got us where we are. We asked everyone, and you can't underestimate this, we asked everyone to pause their lives, basically, to turn around and say, the way you've been living your life, stop it for now.
Were you aware,
to help our community?
Were you aware when you looked at that piece of paper, when the advice came within Comyn or the Chief Minister to say, look, this is what you've got to say to the Manx people? Were you aware of that, the step they had to take?
We knew early on, we had been planning before we even had cases what steps we'd need to take and potentially when. I know looking back now it seems an age ago, but obviously we saw what was happening in Italy. We saw it was coming from across the world and we had time to plan. We didn't want to shut things down too early because we recognised such a change and fundamental effect on people's lives. We wanted to keep as brief as possible, but there was always a plan in the background of the stages where we needed to do things, and particularly when the first case was identified on Ireland, and then secondly when we had the first case where we didn't know where it had come from, where it was clear community transmission.
26 minutes past 12 midday. Health and Social Care Minister David Ashford is with us through to 1. And if you want to get in touch, text 166 177, email studio@manxradio.com, or you can call 66 13 68. Health and Social Care Minister David Ashford is live. I was looking at today's Jersey Evening Post, and Jersey's borders could be open within the first 2 weeks of July. The Chief Minister in Jersey, John Lafondre, has confirmed that the schedule of essential lifeline flights between Jersey, Southampton and Gatwick have been extended till the 19th of July. But the Senator said he expected airlines to be operating commercial flights before that point as well. They can fly to France as well. What's the state at Ronaldsway?
So currently, Andy, I'm aware of the changes that Jersey are potentially proposing. Obviously, there'll still be testing going into Jersey. We don't use the same criteria as Jersey. They're doing double or 3 swabs. And unless someone proves positive, they don't have to isolate. We don't believe that's the right thing to do at the moment, because we know in the early days of the virus, even during incubation, someone could actually be swab tested and test negative, but then go on to actually prove positive. So we haven't gone down that route. We're sticking to the strict 14 days. They're expanding their flights, but at the moment there's still that choice in Jersey between testing or isolation. It's not just a free-for-all.
So the Isle of Man wouldn't be following that model?
We won't be following that model in terms of testing at the moment. Obviously, if the risk profile in the UK drops on near neighbour, and obviously we've got to remember we're right by the northwest of England, which is still struggling in many respects to control the virus, we'll make decisions around that. And there is due to be a Borders roadmap published later this week, I hope, where the public will be able to see the various different stages in our Stay Safe document as to how we plan to slowly but surely release the borders over time.
What about flights to Northern Ireland and the Republic?
So obviously we've got to look at this from a commercial point of view for the airlines. At the moment, with border restrictions and limited passenger numbers, it's around whether or not it's commercially viable for the airlines to do so. If the airlines came forward with proposals to do so, there'd be nothing to stop them. But I think from a commercial airline point of view, there perhaps isn't that commerciality yet for them to be willing to reintroduce flights direct to the Republic of Ireland.
And obviously there are commercial imperatives within the Isle of Man. We're a small jurisdiction. We've got 1.6 billion in reserves, not all of it that liquid. And obviously we need to get back to work. So how do you square the circle of what's going to be commercially beneficial to the Isle of Man and what affects the public health? Which comes first?
Well, it's a balancing act, to be perfectly frank. I mean, obviously, from my role as Minister of Health and Social Care, obviously the overriding imperative for me is the health of the nation. But we do recognise as a balancing act. We've recognised that the whole way along, and that is why we've done things stage by stage by stage, and we've got now to the point where we've been able to open an awful lot of the internal economy. It's the external-facing economy, such as tourism, that is currently obviously still in a serious situation because they can't operate.
And who'll make the decision? Which information will you look to kind of break that logjam? That'll be UK information.
So in terms of the borders, yes, we'd be looking at what's happening around us, because that is the biggest impact and the biggest risk for a reimportation of the virus into the island. So we would be looking at what the levels of infection across the population is in the UK, and it'll make more sense when people see the roadmap hopefully being published later this week, and they'll be able to see the different criteria that government has put for the various different stages of border relaxation.
What's a disinfectant tunnel? Somebody's talking about disinfectant tunnels used in certain areas being a feature at the airport in the future.
If I remember rightly, they're the sort of polytunnels. If I'm thinking, I might be thinking completely the wrong thing, but I'm thinking of the ones that they use that are polytunnels that spray disinfectant down. That wouldn't necessarily wouldn't necessarily get rid of the virus, because if someone's carrying the virus in their body, they only have to step out of that disinfectant tunnel at the end, wipe their nose, wipe their eyes, put it down on the surface outside. So I'm not quite sure if it's the disinfectant tunnels I'm thinking of, that they'll actually have the correct mitigation.
A question in from Steve. Could you ask Mr. Ashford what support and help are being given to the employees of Abbotswood now they're unemployed?
So the employees, where we can, we've been looking to see if we can give them either fill vacancies within DHSC. We've also been looking to see if we can even offer bank shifts to those that want to. We've also obviously there's the schemes, the MIRA scheme at the moment, in terms of trying to support them. So we have been trying to support staff and offer positions where we can. The one thing I would say though is obviously we don't have that level of vacancies to be able to help everyone, and the same with the bank shifts. But certainly those Abbotswood staff that have got in touch and given their details, we have been trying to help them as and where we can.
A question in now, when will we be able to visit people in care homes and vulnerable people in care homes?
So there is a visitors policy in place now. A lot of the care homes are private, so they will obviously set their own policies around visiting and what they feel comfortable with their premises. The only thing we've laid down in terms of visiting is that it should be for a set period of time decided by the home. That they should be risk assessments for each of the homes as to what the impact would be, and potentially operating a booking system, and obviously a record of who's coming in and when, should any contact tracing be needed. But so it's very much in terms of timings and everything down to the home across DHSC. We've started to allow visiting within the home, but there's still a good way to go.
So a question in about diabetes now, and somebody said, given that anybody who's diabetic was on the vulnerable list during coronavirus, will the Health and Social Care Minister be advising people basically to adopt a more healthy lifestyle, and if you can rid yourself of diabetes, to do so?
I mean, I would always advocate that. I was advocating that long before COVID-19, but we also have to remember there is an awful lot of cases of diabetes where people can't rid themselves of it. It's not due to health lifestyle choices.
Often inherited.
It's often inherited. In some cases, it comes out of nowhere. I know I've got friends who are diabetic who none of their family are diabetic, but they're type 1s where they can't get rid of it. So it does have to be remembered that not everyone with diabetes is a lifestyle issue. It's actually a medical issue. The reason they were on the vulnerable list is we had seen evidence from around the world with how COVID-19 as a virus interacted with people with diabetes, particularly the more serious type 1 diabetes. So that's why we had them on the vulnerable list.
David Ashford MHK, North Douglas MHK, is with us, Health and Social Care Minister, on the Mannin Line today. The Chief Minister has a question and stated that the island now expects an influx of new residents. There's been unprecedented inquiries about coming to the Isle of Man. Is this advisable?
I think DFE has received quite a lot of indication from people wanting to move to the island. I think it's actually a good thing for the island that people want to move here. Obviously, at the moment, there's still limitations around people being able to do that. But I think it's a very good thing, and it's showing that the Isle of Man is an attractive place, both to live and work. I know from my email inbox as well, there's also been businesses that have been in touch about relocating to the island longer term because they see the island as a good place to be working from. And that's a positive thing, I think, in the long term for our island.
OK, a question in that said, some places around the world have handled this better than others. Have you had any inquiries from around the world as to how we've handled this?
We do. We work with other jurisdictions. So, for instance, the Chief Minister and myself have both engaged with the UK government over various things that we do. We constantly speak to our Channel Island counterparts as well. So we have had inquiries as to how we've been doing things. One thing I would stress is obviously some things are easier in a small island than they are in a huge jurisdiction to be able to do. So that does play a bit of a difference. But no, there has been some interest from other jurisdictions around what we've been doing.
Jill sent us an email to say, Health and Social Care Minister, New Zealand now has 9 active cases, up from 0 a week ago. All are isolating in government-monitored isolation hotels, except the first 2 who are isolating elsewhere. One person tested positive 12 days after landing in New Zealand. This shows we need to keep very tight control of arrivals here.
Yeah, so this is the 14-day thing again, which I go back to about the incubation period of the virus being up to 14 days. If you're tested in the early days of incubation, we do know that the PCR test can come back as negative. But then, as probably happened with this lady, as that time period goes on, then you can actually end up testing positive. So the 14 days and the border controls we have in place have been the great protection. The one thing I would say, though, and it was in the bit you pointed out there, Andy, with New Zealand, those new cases, apart from obviously the lapse with the two ladies that we know of where they let them out without being tested, the others are all in quarantine facilities. So these aren't new community cases in New Zealand. It would be the same as someone coming into the island, them self-isolating for 14 days away from everyone, but they test positive. That would show as a new case on the Isle of Man. But where the concern would be is if we started seeing community cases.
Victoria sent us a tome now. Hi, I've just been to hospital for treatment, which was great. Most of the staff were wearing masks, great as well. In A&E, everybody was wearing masks, but in the blood clinic, nobody's wearing a mask apart from 3 people who were standing well out of the way and looked petrified. Why isn't it common standard to wear masks all over the hospital, not just certain areas?
Well, my understanding it was. So I will actually raise that with the Director of Hospitals and try and find out.
As for the borders opening, why not leave it a bit longer, as in the last week there are second spikes popping up all over the world, including Wales and England. Surely it's more important to keep people safe rather than people just wanting to go on a shopping trip pretending they're going to see relations. That's just selfish. Stay safe. So here's the million-dollar question. When will the borders open?
Well, like I say, Andy, there's a roadmap being published later this week, and I'm not going to steal the thunder of the roadmap document. You're going to have to wait and see that. And there is a set of criteria against that. As I said, we're not going to go, as with most of the things we've done, we're not going to go from borders closed to borders open. It'll be a phased approach based on what's happening in the UK. And in relation to that question, I need to make absolutely clear there is no intention of going straight to open borders. I don't think that would be sensible with the situation in our near neighbours at the moment. And I think that would be a great risk to the island. It'll be a staged approach, and from the roadmap document, people will be able to see the criteria as to what we will do at each stage and what criteria the UK would need to be at for us to do that.
Here's a question now from Jack, and you must have repeated yourself millions of times. I missed your earlier comment about returning residents. I'm hoping to get back home. Will it mean an overnight stay at a Manchester hotel? Will I then get into a situation where I'd then have to self-isolate in the UK?
Right. The thing I need to make clear is the self-isolation policy in the UK doesn't mean you have to self-isolate in the UK for 14 days. So let's do a scenario is probably the best way to describe it. If someone flies in from Spain and then they've got an overnight stay until they come back via boat the next day, what they have to do is come into the UK, drive direct to that hotel, self-isolate there until the next day, but then they are free to travel direct from that hotel to their port of exit. So if you're in the UK, it doesn't mean you've got to do a full 14 days isolation before you can come back, which is what I think the question is getting at.
Okay, and we've all been full of Manx whispers for weeks and weeks and weeks. I'm just going to give you one Manx whisper. They've been to Tesco this morning talking to the lady on the checkout who said they'd had a customer this morning who was a key worker from the UK who was working here but had also been to Germany and Tenerife recently for work. Don't they need to self-isolate on the island?
If they're a key worker, they do need to self-isolate, but it would depend if when they say recently, if they've been in the island obviously and completed their 14 days even as a key worker, then they are free to move around the community.
Now, you get thousands of emails. How do you separate the Manx whispers and the rumours and the conspiracy theories from what's reality?
Well, thankfully, we've got very good teams within health and social care. It might just seem to be me sometimes up in front, but I've got a great team behind me. It's a brilliant team in the Cabinet Office as well. So where I'm being told something, I can very quickly normally check it out and find out what the truth is in the background. We've got a brilliant team, and I want to thank them all, actually, for the hard work that they've been putting in.
You've relied on people to do the right thing on the Isle of Man, haven't you?
We most certainly have, it could have gone different ways. The Manx public could have turned around with the message we were putting out and saying, well, actually, no, I'm just going to carry on living my life how I want to live it. But the Manx public, the overwhelming majority, 99.9%, actually took this on board, realised how serious it was, and I'll be quite frank, they've saved lives in our community by doing so.
16 minutes to 1 on the Mannin Line with the Health and Social Care Minister, David Ashford.
This is the Isle of Man talking, the Mannin Line.
Text 166 177, email studio@manxradio.com, or talk to David Ashford on 66 13 68.
The Nation Station, Manx Radio.
Friday, 4 to 8 p.m. and Saturday morning. Haldane Fisher.
The Mannin Line with Andy Wint. Furnished by Magic
At
Carpets.
13 minutes to 1 with the Health and Social Care Minister, David Ashford. Adam, you're live on the air with the Minister.
Hiya. Congratulations to the Minister on his handling of COVID-19. He's done a very good job. I just wanted to ask him what he thought the prognosis was from a global perspective, obviously with London and New York being the world's leading financial centres, and the US. Donald Trump in the US has done an appalling job, really, with COVID-19, and cases are still going up in America, but obviously the borders can't remain closed forever. And the Isle of Man is a financial sector, and there's obviously, under normal circumstances, a lot of traffic between here and London, and as I say, between London and the US. And how does he think, things going forward? What does he think the future holds in the immediate to mid-term?
Well, Adam, I think you're 100% correct. We can't keep the borders shut forever. We can't divest ourselves from the world forever. For us, the key measures are our near neighbours. We can't keep everything shut down and locked away forever because COVID-19 could be here forevermore. There's no guarantee there'll be a vaccine or anything else to get rid of COVID-19. So we have to look at the risk factors. For instance, if you look at the daily figures as they stand literally now, the USA accounts for about 40% of all active cases around the world, which is obviously a serious risk for that continent. But in terms of us, that risk factor is probably less of a risk. I hope that over the next couple of months, all jurisdictions will be pulling together to try and minimise their case numbers, and we hopefully should be seeing declines, I would hope, across the world. But yet we have to take a risk-based approach, and our risk is basically our near neighbours.
Right, okay, that's brilliant, thank you. I mean, I'm sure we all hope that Donald Trump will be out of office in 2 months' time, and hopefully a new president will adopt a more responsible approach, but there's no guarantee in the future, is there?
Well, no, time will tell. The American electorate will decide in November which way they want to go in terms of the American government.
OK, Adam, thank you for calling today. And here's Stephen. You're live with David Ashford. Stephen.
Good afternoon, Andy. Good afternoon, listeners, and good afternoon, Minister. Really, you've partially answered that question that I wanted to ask, which was, will we still be going for eradication of the virus as we go forward, or will the department seek to manage the virus within the community? Because obviously you're a clever man, David. You know that once the summer leaves us and winter comes, we'll have the normal colds and flus and all the viruses that come with it. Some of them will not be COVID. So do we have a robust plan in place to manage the virus within the community, or will it be the blunt instrument of lockdown?
Well, thank you, Stephen, but it won't be the blunt instrument of lockdown. Lockdown would only be reconsidered if we had the virus multiplying at a high rate. So the Stay Safe document the government's already put out, the medium-term plan, within there's a handy table that shows a RAG status, red, amber, green and black, in fact, added to it as well, as to the 3-day average of cases across the island, which would show what actions we would have to put in place or rewind depending upon the number of cases actually developing. At the moment, in terms of eradication, I mean, that can only be achieved, eradication can only be achieved on a worldwide scale. It can't be achieved locally. We can get zero transmission and a local elimination, but eradication would be eradicated around the world.
Thank you. You've answered that part. The second point I'd like to make is that I'm very pleased that we are in the common travel area, and from what I can gather from your comments, the island is not proposing to withdraw itself from the common travel area, because the thought of passport control on the island, I would be firmly against. But secondly, there's always the reaction from the other party who could impose severe restrictions on our ability to do trade and enter into the UK from outside if we decided to unilaterally withdraw from it. So that pleases me greatly. But I think what you're saying is you've no intention to do that.
Yeah, no, the common travel area is and remains government policy. Personally, I think it's very beneficial to the island that we have the free movement of people between the UK and our near neighbours, and I think it's essential for our economy. And I don't think that has changed, and I can't see it changing in the immediate future. So there is no proposal to review the common travel area.
The last point I'd like to make, and I know it's not broadly supported by many people because a lot of people are perfectly happy with the severe punishments that we introduced for breaches of COVID regulations and the high number of imprisonments. But what I'd like to ask, David, is why did we, as one of the few jurisdictions, when we passed the emergency legislation, decide to imprison people immediately? Why didn't we use the ability of fixed penalty notices? Now, in the United Kingdom, they start at £30 and rise accordingly. And in certain cases, police forces were advised by the Home Office in the UK to try and curb the enthusiasm for enforcing lockdown. So the point I'd like to make is, I believe the Council of Europe, for example, advised all the states to reduce their prison population, firstly, and secondly, not to give prison sentences for breaches of COVID and or other punishments in order to keep the prison population low. So it does concern me that we have increased our prison population for minor breaches, and it does concern me that the mental health effect will be on those persons who have been sentenced, and also the mental health which will have been on the wider community during this. So will more resources be placed into mental health to help cope with these problems that will probably come about?
Right. Well, I think the first key thing to say, Stephen, is I think people are taking the overall number of arrests and translating that into people going to prison. That's not the case. So, for instance, there have been 84 arrests over the COVID period. 41 of those have resulted in an actual prosecution, but the actual number who have sentenced to actual time in prison, as far as I'm aware, is only 12 people. So I think, people looking at the overall figure and thinking that's time in prison, but we've got to remember as well that the breaches that have occurred in some of those breaches in COVID-19 are quite serious. So someone who breaches self-isolation and goes out into the community deliberately, there's actually a risk of spread there and actually infecting other people. So it is quite a serious matter if people are directly not complying with direction notices or are intentionally going out and doing something.
OK, thank you, Stephen. Thanks for calling us today. And we're just about out of time with Health and Social Care Minister David Ashford. So in 30 seconds, vaccine.
Vaccine, it literally depends. There is no guarantee there will be a vaccine for COVID-19, but at the moment the research is looking positive. OK, and as far as the roadmap is concerned, that's going to be when? Later on this week? Later on this week, I'm hoping.
OK. It's Education, Sport and Culture Minister Dr. Alex Allinson with the Chief Minister today at 4 o'clock, live on Manx Radio. A pleasure to see you, David Ashford, in flesh, in the person, after so long of talking to you down the phone line. Thanks for being with us
Great to be
today.
back in the studio, Andy.
Good to talk to you. The Mannin Line is back tomorrow. By the way, this coming Wednesday, children's champion Rob Collister will be here, and on Friday, the Education, Sport and Culture Minister, Dr. Allinson. And thanks to studio producer today, Howard Kane. I'm Andy Wint, and the Mannin Line is back tomorrow at the same time on Manx Radio.
WINT.
We live in very challenging